Hi everyone, this is Yesenia Reta from Fullness of Life Counseling in Bradenton, Florida. I'm a licensed clinical social worker with a private practice that sees teens, adults, and families that are going through a variety of struggles, be it personal, individual, or as a group, as a family. And so I've been doing some videos. Last week I shared 2 videos on anxiety, on the topic of anxiety. Video 1, I talked about the symptoms of anxiety and recognizing those. And video 2, I shared a little bit about the causes. And today I'm just going to do a 3rd video on the treatment of anxiety and what is out there to improve anxiety, because really living with anxiety is hard and it's not fun at all. And just people shouldn't be suffering with it when there's so many things that can be done to help. So the first type of treatment is psychotherapy, also known as therapy or counseling. Psychotherapy can be very helpful with anxiety. And so I'm going to do a video in the future about the process of psychotherapy. But, when we think about the word therapy, it's changing something or improving the use of something. Learning how to reuse something, that's therapy. So when we think of psychotherapy, it's learning how to use our brain and our mind in different ways. So one of the popular treatments and that has research is CBT, cognitive behavioral therapy. So in a few words, it's understanding that how we think affects how we feel, which then affects what we do, or in this case with anxiety, sometimes don't do because of our feelings. So, learning how to change our thought process and then affect our feeling, learning how to manage our anxiety is something central to CBT. And there's many other types of therapies also that help with anxiety, but CBT has one of the ones that has a lot of research to it. So if you're interested in that, you can Google research studies done on treatment of anxiety psychotherapy. You can learn more. So going to psychotherapy alone can be a treatment for anxiety. Another one is medication. Now, I'm not an expert in this because I don't prescribe medication. A lot of people think that therapists prescribe medication. We do not, at least licensed therapists. Now, psychiatrists can prescribe, MDs, doctors can prescribe, but not licensed clinical people. We can diagnose, but we cannot prescribe medication. We can, however, work hand in hand with your doctor, with your psychiatrist, to make sure that you're, to coordinate your care. So we can do that. But, a lot of times doctors might use anti-anxiety medications or even antidepressants to help with the symptoms of anxiety. Now, of course, as a clinical professional, the best thing you can do is have both psychotherapy and medication because medication alleviates symptoms. But psychotherapy is actually where you can change the mind and really learn skills on how to manage the anxiety. So, some people choose to just take the medication, but they discover that when they stop the medication, the anxiety may still be there. So may or may not. It depends on the person. It depends on the anxiety. But so if you can do psychotherapy, if you can dedicate some time to psychotherapy, and a lot of times it's not as long as people think. Some people think, well, it's a burden of time and money. Well, yes, it's expensive. Yes, it takes time. Sometimes, not always. It may seem that way, daunting, but it's only short term compared to the long-term effects of anxiety and stress on your body. So it's really an investment in your health and your mental health. And that's the thing about these videos. If we can start to see our mental and emotional conditions as just as important as our physical health, that's really what my goal is, for us to start to realize that these are important topics. These are important situations that we have in our life that we need to address. So psychotherapy, medication, the combination of both, one or the other, it really depends on you and what you prefer. And then there's complementary health approaches or natural or alternative ways to manage anxiety, such as stress and relaxation. It could be like becoming consistent with massages or, anything that reduces the stress. There's a lot of alternatives. There's acupuncture, there's hypnosis. You'll find tons of resources on natural ways to reduce anxiety. But one of the things that I definitely start off with my clients is we start talking about sleep and how are you sleeping? Do you get enough sleep? What's the quality of your sleep? I focus a lot on sleep in the beginning and getting that sleep hygiene in order. And then also we talk about exercise. Exercise is very good for anxiety because exercise allows our body to release a hormone that is a natural anti-anxiety and antidepressant. that's already in us. So, and, you know, I always start to suggest at least 3 times, to start off 3 times a week, 30 minutes a week, a day, and work up. Or if you are starting from 0, 10 minutes a day, work up to 20, work up to 30. I focus a lot on exercise and sleep. And then the third thing would be nutrition. If you have a diet that's high in sugar, high in caffeine, you're drinking caffeine all day, and then you're wondering why you're anxious, well, I know those are the things that sometimes make us feel better, but they can be hurting us in the long run. So looking at our nutrition, increasing more natural and healthy foods, vegetables, fruits, water, lots of water is also helpful. So these are 3 areas right off the bat, natural things that you can do even before you seek psychotherapy or medication is sleep, nutrition, and exercise. And then, of course, stress. You know, what stress can we eliminate from our life that's unnecessary? We really have to take into account what is causing me anxiety, what is the cause of my anxiety, and how can I remove or reduce that stressor in my life. So those are some basic things. I just want to encourage you to send me any questions you might have. You can message me privately. You can text me at 941-800-1513 if you have any questions, because next week I want to just follow up with some common misconceptions or questions that I often get about anxiety. So I hope that these last 3 videos have been helpful to you, and that you seek, if you or someone you know is suffering with anxiety, that you encourage them to get the treatment that they need, because there's a lot of ways to treat it that aren't so healthy, such as, I should have said that, what not to do. Drinking, using food to soothe can become a problem. Drugs, of course, and other addictions. Addiction in general can come as a result of anxiety. So that's a way that as a society we tend to numb or self-medicate anxiety. And so that doesn't have good outcomes for people. So, you know, definitely encouraging these healthy approaches to relieve anxiety, psychotherapy, or medication, or both, and then natural approaches to it as well. So thank you so much for your time. I'll be following this up with a Spanish video. Remember to share with your friends, and if you have any questions, please feel free to reach out to me. Have a great day.